didn't wear it today. All right, well, good afternoon. First of all, I want to thank all of the Planned Parenthood staff who are joining us today from all over the country. It is wonderful to have all of you here. Thanks for being here. And of course, I want to thank my senators who are joining us today. They are all fighters. You'll have an opportunity to hear from them. But we are here today to make one thing abundantly clear, and that is that the extreme, unconstitutional abortion ban that passed the House just weeks ago and which is being shopped around by right-wing sponsors, for right-wing sponsors here in the Senate, is a non-starter. Regardless of who introduces it, it's going nowhere. At a time when our workers are being furloughed and our student loan rates are going up and investment in research and education is being slashed, the last thing we need is a politically driven distraction like this is. Make no mistake, this is a direct attack on Roe v. Wade. It is a bill that is a response to right-wing radio hosts and columnists, and frankly, women's health is an afterthought in this bill. This is also part of a disturbing pattern we are seeing in legislatures in states across our country. We've seen in Texas, where over the past few weeks, one of the most restrictive abortion bans in the country is being pushed. We've seen in states threatening to subject women to invasive and degrading ultrasounds. We see it in states like Ohio, where provisions that restrict access to abortions for rape survivors are being snuck into law. And we're seeing it in the targeting of Planned Parenthood. And of course, we're seeing it in the House of Representatives, where despite the fact that the House Republican majority ran on jobs in the economy, the first 3 bills that they introduced, the first 3 were each direct attacks on women's health in America. Clearly, Republicans have not learned. In states across the country, voters have rejected one candidate after another who politicized rape and ran on restricting a woman's right to choose. But now, as we see, Republicans are back at it. Despite the fact they had to bring in a paid pollster to tell the entire House Republican caucus to stop talking about rape, even that message has not sunk in. But trust us, we are not going to stop reminding them. We are not going to stop reminding them that women are not going to stand for being part of a political plea bargain, that women's health is not a turning chip that they can use in their debates, and that women and doctors are not going to be turned into criminals. We are not going back, not to the 1950s, where the Republican rhetoric on this issue seems to be stuck, or to 1973, when this issue was decided. We're not going back on settled law. This bill, like attacks on Roe v. Wade before it, will eventually be lost to history. But I can assure you, it won't soon be forgotten by millions of American women. Again, I want to thank all of our senators and those who are speaking and all Planned Parenthood for being here today. And I'm going to turn it over to my good friend, Senator Barbara Boxer, who has stood by my side for more than 20 years out here on the Senate floor, fighting back to protect women's health.
Thank you so much, Senator Murray. It is an honor to be here with you. Thank you for calling us together. And to our friends who are here from Planned Parenthood, we're so proud of you. You're so courageous, and we're very happy to stand with you. So we're here today to say the extreme and dangerous 20-week abortion ban passed by the House Republicans isn't going anywhere in the United States Senate, not on our watch. Republicans clearly didn't learn anything from the 2012 election, when voters rejected their war on women and asked us to focus on making their lives better. Americans want us to go back to work, not to go back to the last century. Republicans across the country, and we see it every day, and I know Senator Baldwin will talk about what's happening in her state. We see it in Texas, we see it all over, we see it in the House. Republicans across the country are waging now their biggest assault yet on women's health, a direct assault on women's health, on doctors, and on Roe versus Wade. Make no mistake, the abortion ban passed by the House is a radical bill. It offers no health exception, No help for women facing cancer, kidney failure, blood clots, or other tragic complications during their pregnancies. It offers no exception for rape or incest to victims who are unable to report these heinous crimes against them. It throws trusted doctors into prison for up to 5 years for simply providing needed health care to their patients. And now right-wing groups want to bring this same dangerous bill to the United States Senate. They are pushing their extreme agenda, even though the American Congress of Obstetricians and Gynecologists, which represents thousands of doctors nationwide, said the restrictions in that bill are, and I quote, dangerous to patients, unquote. Republicans seem to have no understanding of the heart-wrenching decisions that women and their families are forced to make. Their bill bans abortion after 20 weeks. Now, only 1% of abortions occur after 20 weeks, and there are reasons for it. The three main reasons are severe health impacts for the mother, catastrophic fetal conditions, and restrictive state laws. I'm going to quickly, in my close, give you 3 stories that reflect, these are real stories, that reflect these 3 issues. First of all, the health of the mother. 4 months into Judy Shackelford's pregnancy, she developed a pregnancy-induced blood clot in her arm. The only guarantee that she wouldn't die and leave behind her 5-year-old son was for Judy to end the pregnancy. She and her husband made this very difficult decision to terminate the pregnancy. So why would Republicans in Congress want to hurt our families experiencing such incredible tragedy and pain? Second, when there's a catastrophic fetal condition, here's the story. Christy Brooks of Virginia was pregnant with her 2nd child. After a 20-week ultrasound, she found out her daughter would be born with a severe structural birth defect and would suffocate at birth. Suffocate at birth. She made the decision to end the pregnancy at 22 weeks. Now, why would Republicans in Congress want to hurt our families experiencing such incredible tragedy and pain? And the last story, which involves restrictive state laws. In Missouri, Julie and her husband were told that the baby they were expecting had multiple abnormalities and would not survive outside the womb. Sadly, Julie and her husband had to navigate the complicated environment around pregnancy termination in Missouri because of the laws there. It took them 3 weeks to locate an abortion provider, only to be told that there'd be additional delays because under Missouri's restrictive laws, Julie would be required to travel 2 hours to a facility on 2 separate occasions to comply with the state-required waiting period. They also had to find a way to pay for the cost of a hotel the night before her procedure. When they were finally able to get the care they needed, Julie's pregnancy was a little over 20 weeks. Why would Republicans in Congress want to hurt families experiencing such incredible tragedy and pain? And one more rhetorical question. Why would the party that claims to want government out of our lives put government into our lives during our most personal and excruciating moments? Why would they push a bill that continues their war on women after Speaker Boehner said, job creation, that's our #1 priority? Because it isn't about what's best for women and families. It isn't about what's best for our communities. It's about what is best for the extreme right wing of the Republican Party. So yes, we're going to stop this dangerous bill in its tracks. And we are sending today a clear message that in the Senate, U.S. Senate, we will protect women across America. And it is my honor to introduce a gentleman who stands with the women on every issue that we ask him to be part of, Senator Richard Blumenthal.
Thank you. Thank you to 2 great champions, Senator Murray and Senator Boxer, and I'm going to be followed by 2 more. And I want to particularly thank Senator Boxer for that eloquent, powerful statement, and most especially the stories that she recounted. And the stories that are brought to us by the courageous and strong Planned Parenthood visitors who are here today, I felt as I entered the room that energy and strength that you bring to this cause, and it's always inspiring and uplifting, and I'm very, very proud to be here today. Those voices and faces really embody this issue. This is not merely an abstract issue of constitutional law. It is about individual lives affected by women's health care. And it's about families that are irreparably damaged when constitutional rights are denied. It's about interference in one of the most important relationships that has to be protected, the relationship between a doctor and a patient. We're not here to tell any patient or any doctor what is appropriate in terms of health care. Those decisions should be made in the privacy of that relationship, along with clergy and family, and it is the privacy of that relationship that the law protects. That's the constitutional right. And it's a right that was decided across the street decades ago. I was a law clerk to the justice who wrote the opinion in Roe v. Wade. Back then, it may have seemed novel. There should be no question, absolutely none, in light of the decisions that have followed Roe v. Wade, that this right is firmly established in our Constitution, ought to be firmly established in this building as well as that one, and any restriction of the kind proposed and adopted by the House is a non-starter here. And, you know, in the 2.5 years that I've been here, one of my regrets and frustrations has been that we are returning recurrently to this war on women's health when we should be working on job creation and economic growth and, yes, student loans. If you leave Washington and you go out to the country today, people will be asking why the United States Senate is failing to deal with student loans. That ought to be our focus, not a misguided and mistaken attack on women's health. And as abstract as those constitutional principles may be, we have a lot of work to do in the states, because in those states there are more and more draconian legal measures adopted and passed today in Texas by the State House of Representatives, possibly tomorrow by its state Senate, and in 17 states in the last 6 months, 43 restrictions on reproductive health care. In 2000, less than 1/3 of women in the United States lived in states with extreme restrictions on abortions. As of 2011, more than half of the women in this country lived in those states. We have work to do. We're saying today, hands off women's health. It's bad policy, it's bad law, and it's bad for the country. And now I want to introduce someone whom I have come to really admire in the short time that we've worked together, my great friend and colleague, Tammy Baldwin, Senator from Wisconsin.
Thank you, Senator Blumenthal, and I am proud to stand here with my colleagues as well as volunteers and staff from Planned Parenthood across the country. Recent actions in state houses as well as Congress have once again brought into sharp focus a particularly troublesome element of the Republican agenda. And once again, that agenda hinges on attacking women's access to health care by putting politicians between a woman and her doctor. Their campaign to restrict women's freedoms are all too real for women and families in my home state of Wisconsin. Just last Friday, our Governor, Scott Walker, signed into law a bill that severely limits access to health care services for women in my state. This law not only forces women to undergo medically unnecessary and invasive procedures, but also imposes unreasonable requirements on the doctors that deliver care to women. Our governor thinks he knows better than women and their doctors. This extreme mandate may force several health clinics in my state to shut their doors and others to strictly and severely limit services that they are able to provide. A federal judge has now temporarily blocked the regulations from taking effect, which means these clinics will remain open for now. But women should not have to rely on last-minute court decisions to be able to make the best health care decisions for themselves and their families. And I want to make one thing clear. These bills, from Wisconsin to Washington, D.C., are not about allowing women to make informed choices. They are about attacking basic American freedoms. Incredibly, Republicans continue to ignore what Americans said in the elections, instead of focusing on job creation and economic development and getting our economy back on track and growing our middle class and helping students afford loans for college. They are waging a war on women and families. I am now pleased to introduce somebody who labored with me in the House of Representatives against these attacks for many, many years, and I'm so glad that she entered the Senate with me, Mazie Hirono.
Good afternoon, aloha. I'm proud to represent the first state in the nation that decriminalized abortion, and that is Hawaii. The 20-week ban on abortions is yet another example of attacks on women, on women's health, on women's choice. Now, I know that the people I'm standing with, maybe not so much the young women I see behind, many of us have been fighting the choice for women battle for decades. I wrote my very first political letter supporting abortion over 40 years ago, and we're still fighting those battles. And in fact, they just keep on coming. State legislatures have passed hundreds and hundreds of bills over the last decade limiting a woman's right to choose. So I'm proud to stand here with my colleagues. There are many others who could not be here this afternoon who believe that women's choice, abortion rights, is a constitutional right. And yes, we ought to be spending our time focusing on fair, comprehensive, sane immigration reform, on lowering the student interest rates, on creating jobs, getting our economy going, not on bills like this that attack women. Thank you.
We're very pleased to be joined today by Kelly Dupree from Planned Parenthood, who will be speaking next, and following her, Dr. Sarah Immersheim. She's Physicians for Reproductive Health, and we're delighted to have both of you here. We'll start with Kelly.
Hi, my name is Kelly Dupree, and I work at Planned Parenthood of Southwest and Central Florida. Senator Rubio has certainly not been an advocate for women on their access to health care during his tenure in the Senate, but leading the charge on dangerous legislation to interfere in deeply personal medical decisions that should be between a woman and her doctor would be a new low. People in Florida and across the country know that abortion is a deeply personal medical decision, often complicated decision for a woman to make. These decisions should be made by a woman in consultation with her doctor, her family, and her faith, not by Senator Rubio or any other politician. Abortion late in pregnancy is extremely rare. As was earlier stated, nearly 99% of abortions take place before 21 weeks. But when it does happen, it is often a heartbreaking and tragic situation, the kind of situation where a woman and her doctor need every medical option available. We've already seen what happens when politicians interfere in these deeply personal medical decisions and tie doctors' hands. In states that have already passed laws like this, some women and their families have been put into unimaginable situations, as those described by Senator Boxer, needing to end a pregnancy for serious medical reasons but unable to do so. Doctors oppose these laws because they prevent them from giving their patients the best health care possible in an individual situation. The bill that Senator Rubio or any of his colleagues introduced won't become law. We thank the President and champions of women's health in the Senate, like those standing up here with me today. But bills like the one Senator Rubio may introduce aren't really about the very rare cases where abortion happens late in pregnancy. They're part of a coordinated strategy by politicians and groups across the country who want to end safe and legal abortion entirely. We saw in state legislatures over the past few months that a ban on abortion at 24 or 20 weeks passes, and then it's on to a ban at 12 weeks or 6 weeks, before a woman even knows that she's pregnant. The same people pushing these laws are trying to take away access to birth control and defund Planned Parenthood's other preventive health care services. We're seeing this play out in states like Texas, Ohio, Wisconsin, and North Carolina. And we're seeing people all across the country stand up to literally force these politicians to hear their voices, and stop passing these dangerous bills. The bottom line is these bills have nothing to do with protecting women. They will not promote health care, they are dangerous, and they are extreme, and women are already paying the price in states where these laws have passed.
Good afternoon. My name is Dr. Sarah Immersheim, a board-certified obstetrician gynecologist practicing in women's health for more than 30 years. This bill criminalizes the sound medical care that we doctors provide and will compromise the health of women, especially those with complicated pregnancies and life-threatening medical conditions. As physicians, my colleagues and I are responsible for delivering the highest quality medical care to our patients. This legislation interferes with my ability to care for my patients. Most women can expect an uncomplicated pregnancy, but for some, providing timely and safe abortion is potentially life-saving. A medical plan of action involves the patient, her family, and the science-based counsel of her physician, not Congress. This bill does nothing to improve women's health and safety. Instead, it puts our patients at risk. I urge the Senate to stand against this harmful legislation. Thank you all very much.
Thank you. With that, we're happy to take questions.
Senator Murray, obviously if this bill were...
Can you tell us who you're with?
Jeremy Peters, the New York Times. Obviously if this bill were to come up, it wouldn't have votes to pass. So I wonder, would you support letting it come up so you could vote against it?
I'm going to tell you this. We have so much work in front of us right now. This is almost the middle of July. We are facing our responsibility to pass a budget, to pass all of our appropriations bills in a responsible manner so that we don't put this country back into a crisis again. What our constituents across the country are expecting us to do is to help create jobs, grow the economy, and govern this country in a responsible way. We are not going to get diverted in the United States Senate by a long, protracted debate on an issue that has been settled law and that is dangerous for women's health.
I want to add one thing. As you know, in the Senate, anyone can offer any amendment to any bill, pretty much. And the question is, how do we respond to that? Now, if this bill were to be offered, this as an amendment to a bill, we would fight against it and we'd defeat it. But I think it says a lot about someone who would move forward with such a bill that doesn't have a chance of passing, okay? And frankly, you know, with a pro-choice president, I might add, to the equation, and a pretty much pro-choice Senate in terms of the majority of us, and bring such a bill forward that is considered very harmful to the health of women, that won't pass, and takes us off the work we're trying to do. I just want to say something, because Senator Murray, she's humble about it, but as you know, she's the chairman of the Budget Committee. She's been on the floor, I don't know, once, twice, 3 times, 15 times already, asking, it just, to her, she's been counting. 15 times asking the Republicans to allow us to go to conference on the budget. And the same people, frankly, who are champions of this bill, and you know who they are in the Republican caucus, are saying, no, we're not going to go to conference. And yet, they say they want to have a budget. So she's exactly right. It would say a lot about our colleagues if they brought this up as an amendment, knowing how it divides us, knowing how it will, in fact, never become law. It will be a message to the American people that they did not get what the American people said in 2012. We want, they said, the Congress to work together to make lives better for them on jobs and all the other issues. So when you ask, will we allow it, look, anybody can do whatever they want, but I think we'll dispose of it in pretty short order.
And, you know, we don't have a lot of time before the recess.
We're not gonna waste time on an issue like this. Yes.
Today, Senator Carl Levin, wanting this, using the nuclear option, said Roe v. Wade could be one of the things the Republicans would overturn if you guys were to go that route. I just wanted to get your response to using that.
Are you talking about the filibuster
Yes.
changes? I have not yet seen what the leader is putting forward in terms of a proposal, or if he's putting a proposal together. I think there is a lot of frustration right now in terms of all the nominees that have come before us, people whose lives have been put on the line for months and months and months and years. So they're waiting for confirmation, and I think that's what he's focused on. But we'll all look at his proposal when he moves it forward.
I wanted to add, I haven't heard any proposal to be that far reaching. What I've heard is that we're looking at these stalled nominees of the president's team that have been waiting in limbo for more than 200 days. That's my understanding of what he's going to do.
Questions? All right.
Would you support a prohibiting abortion after 40 weeks or at any point?
Look, what we're talking about is protecting the lives and choices of women across this country to make their own health care decision. We are listening to doctors. We are listening to women themselves and many men who are saying we have a right to make our own health care decisions. The law is settled, as Senator Blumenthal talked so eloquently about. The courts have settled this case, and we're here to defend that.
What
And
about
by the
if
way, I don't know that you've ever read Roe v. Wade, but it definitely does, in fact, say a woman's right to choose is not infinite. It's before viability. So what you're talking about doesn't really make sense. I'd suggest that you read Roe v. Wade because it's a very balanced decision. And what we're here for, and I think it's very important, is to say we have a bill that doctors tell us unanimously is dangerous to women. And we're here to tell you and everybody else here from the media and the public that we're going to fight it. We're going to use every ounce of fiber we have to fight it, and we thank you very much. Thank you.
mentioned medical reasons. What about elective abortions? Would you support a ban?
We support settled law in Roe v. Wade, as Senator Boxer has very explicitly said.
Just read
With
it.
that,
I feel better.
I want to especially thank our friends from Planned Parenthood who have stood courageously out in front on these issues and have really helped Americans understand what this choice is about. It's about women making their own choice with their own doctor, their own religious beliefs, and their own family. And that we can all.
Thank you.
Thank you.